So the concept for the Bedside Communication Handbook actually started about 5 years ago, where my colleague Dr. Ellen Hum and myself actually sat down and we thought that it's high time that we come up with a book that actually talks about communication in healthcare, because truly that's something that has become so important now, with patients and families being a lot more well educated and the greater demand for more information from patients and families as well.
It's also very important that we communicate well with our healthcare colleagues. It's not only a sign of respect for the work that they do, but it's also representative of the seamless model of care that we work in.
And we're excited about this book also because the way that it's done. So every chapter is about a couple of pages long, and it gives you the nuts and bolts and the essentials of communicating in that scenario. So we know that for the busy clinician, this handbook will provide what is key and what is important to help them through those specific clinical situations.
We've been so blessed to work with so many colleagues who really exemplify really good models of care, and this also pertains to the way that they communicate. And they've been so generous to distill their wisdom as well as their knowledge in the different chapters that are represented in this communication handbook.
We've managed to bring together a group of 30 over clinicians of various specialties, as well as our nursing and allied health colleagues, to come together to share their experience, what works and what doesn't work for them.
This handbook was designed to be used at the bedside. It's practical, it's pragmatic, and it also relates to the current challenging times that we practice in the COVID-19 pandemic.
So this book is split into various parts. The first part deals with the basic skills of communication and the basic principles of communication. Then after that, we delve into specific areas like how to communicate in a clinic setting, or how to communicate in a busy emergency department where time is of the essence. And of course, then we have separate chapters for our nursing and allied health colleagues as well, because we believe that all healthcare staff participate in this process of communication, and it needs to be done well. It's not just meant for doctors, nurses, allied health professionals, but it's also meant for young doctors, medical students, nursing students, allied health students as well, because they will need to learn these skills now before they graduate and come out and face the real world.